friends, a warm welcome to Sri Swaminarayan Physiotherapy College YouTube channel. Myself Dr. Aarti Pandya, MPT in Cardio Respiratory, lecturer at SSPC Ranip, Ahmedabad. Today we are going to learn in detail about pulse. So, before I start with my presentation, I would request all the viewers to like, share and subscribe our YouTube channel to get the latest update about our upcoming videos. Now, let's start with introduction. So, the pulse is the wave of blood in the artery created by contraction of left ventricle during a cardiac cycle. So, I hope you all know about cardiac cycle. Basically, cardiac cycle is sequence of contraction and relaxation of the heart muscles. So, contraction is systole and relaxation is diastole. It is a repeating process that pumps out the blood from the heart. So basically there are four structures in our heart, two atria and two ventricle. So but blood only pumps out through left ventricular. Now with each contraction blood is pumped into an aorta and then forced out through systemic arteries. Systemic artery is coronary arteries. It is this wave of blood that is felt as a pulse. The strength or amplitude of the pulse reflects the amount of blood ejected with each myocardial contraction. Now next, in most situations, the heart rate and pulse rate are identical. A difference between the two is called pulse deficit. This indicates that some heartbeats have not caused sufficient blood flow to reach the periphery. The pulse can be palpated whenever a superficial artery can be stabilized over an underlying surface. So basically if you palpate your pulse at radial artery and if you are palpating your pulse directly through stethoscope, if there is any difference between a radial artery pulse and from the stethoscope pulse, that is pulse deficit. Understood? Now, in monitoring the pulse, specific attention is directed towards determining three parameters: rate, rhythm and quality. So let's learn about rate. The pulse rate is the number of pulsation or frequency per minute. Normal rate is 60 to 100 beat per minute. If the pulse is less than 60, that is bradycardia, and if the pulse rate is greater than 100, that is tachycardia. For an example, if you are sleeping throughout the night and in the morning there will be relaxing heart rate like 60 to 70 between. Okay, but if you are running or jogging and then you will measure your heart rate would be more or high. Okay. Now rhythm. The pulse rhythm is the pattern of pulsation and the intervals between them. In the healthy individual, the rhythm is regular and indicates that the time intervals between pulse beats are essentially equal. Arrhythmia or dysrhythmia refers to an irregular rhythm in which pulses are not evenly placed. For an example, if you heard or if you feel 1, 2, 3, 4, that is absolutely normal. Okay, but if you feel or if you palpate like 1, 2, gap, 3, long gap, 4, 5 combined, then long gap and then 6, that is abnormal, that is irregular rhythm of pulse. Okay. Now quality. The quality, which is force and volume, force of blood and volume of blood of the pulse, refers to the amount of force created by the ejected blood volume against the arterial wall during each ventricular contraction. In examining the quality of the pulse, the therapist is determining the flow of the blood as it passes through a vessel. The quantity, which means volume of blood within the vessels, produce the force of the pulse. Normally, the pulse volume of each beat is the same. If you feel or if you palpate, you would feel the same beat at every time. Okay. Then the force of the pulse is greater with higher blood volume and weaker with a lower blood volume. The volume is examined by noting how easily the pulse can be obliterated. A normal pulse is described as full or strong and can be palpated using moderate pressure of the fingers over bony landmark. With lower volumes, the pulse is small is easily obliterated and is termed weak or thready, difficult to palpate. Okay. With increased volume, the pulse is large, is difficult to obliterate, and is termed bounding pulse. A feeling of high tension is noted, which means after running or after jogging or after any stressful work, if your pulse is high, that is bounding pulse. Okay. A numerical scale is often used to document the quality. Quality means strength of pulse. Now there is a grade, different grade of pulse and their description. Now 0 means absent pulse, no perceptible pulse. 1 plus is thready, barely perceptible. 2 plus is weak, palpable but diminished. 3 plus is normal, easy to palpate like healthy individuals. And 4 plus is bounding, very strong after running or any stressful work. Okay. Then monitoring of the pulse. Peripheral pulses are monitored by palpation using the index and third finger of the one hand. Generally, a light pressure is used initially to locate the pulse, and the more firm pressure is used when determining the rate, rhythm, and quality. Now, pulse sites. A peripheral pulse can be monitored at a variety of sites on the body. A superficial artery located over bone or underlying firm surface is easiest to palpable. Peripheral pulse locations are as below. First is carotid artery, here below the neck. Remember? Okay. Then brachial at your hand. Then radial, just distal to a radial head. Then femoral at the groin area, try to palpate. Then popliteal, posterior to your knee. Then dorsalis pedis, above your foot. Then posterior tibial, near medial medullae. Okay. References O'Sullivan and Pryor. You can read from these two books. Thank you.